I just returned from a trip abroad, actually. Came back from Aruba, where I met with the Minister of Health, Minister Schwengel, and this is a follow-up meeting to a meeting that was had here a couple of months ago about improving cooperation between the Dutch Caribbean partners and the Kingdom. We're working on a number of things. We're working on a memorandum of understanding. In particular, Aruba has a need to improve their Inspectorate of Health, and so since we have a well-formed Inspectorate of Health, we're working on a cooperation agreement between us. There's also discussions about an exchange of manpower and expertise between the two countries. And something that I think is important is what I would call a review commission. So we're looking at a commission that would have representatives actually from Aruba, Curacao, and St. Martin. And the idea of it is that when you have medical complaints, and I have to admit that a lot of my time is spent fielding phone calls from people that have issues either related to service from SZV or related to medical care that they receive on the island. And one of the things that really is lacking is a structure where people can voice their concerns, their complaints, and that they would be evaluated in an objective manner. And I think that one of the benefits by having this commission be an inter-island commission is that, number one, you hopefully avoid some of the local sensitivities if it's a commission that's just solely based in St. Martin. And the other possible advantage is because you would pull expertise from the different islands, from Aruba, Curacao, and St. Martin, they also could bring suggestions in terms of best practices, in terms of protocols, in terms of procedures. So again, I think that there's an awful lot that we can learn from each other in terms of best practices and in terms of worst practices. There's a number of things that Aruba, I think, has done that's very interesting. For example, their medical referral system, for example, to Colombia, they used to use Comiva, who St. Martin through SZV is currently working with. But Aruba's developed their own referral program. They've developed their own software, as a matter of fact, to manage that referral program. And so that software allows patients' files to be uploaded, and that's one of the issues that we have in hearing from St. Martin, is that very often patient files don't show up in time. They have a well-established review protocol, so they've found a partner to work with in Colombia that audits the medical bills, but in the end they contract directly with the hospitals rather than going through an agent. And so again, I believe there's a lot of lessons that they've learned in that process, and it's something that St. Martin could consider is, would we look at following the Aruba model? And certainly there's a number of discussion points that make sense, and that's why the continued cooperation between Aruba in particular with St. Martin. Another interesting point is that we're working here in St. Martin on national health insurance. So Aruba has universal coverage for quite some time already, and so we had meetings together with the ministry and also together with representatives from the AZV, Mr. Anko Rinkeling and Lex de Jong, who are representatives of AZV. They've been there for a number of years. And so it was very interesting to talk to them about their experiences in terms of their universal coverage, what works well, what some of their challenges are. And again, as we look to share best and worst practices with each other, we're hoping to adopt some of the lessons learned in their process to St. Martin's national health insurance scheme. And that's something that is in progress. And it's also something that's tied to financing of the hospital. It's an item that's been identified by the CFT as a point that needs to be addressed in the business plan. And I believe it's also is a factor to be handled in the budget as well, in terms of as CFT looks at the stability of the budget going forward. So having national health insurance program in place. Certainly, all of the details won't be worked out, but certainly the framework can be worked out and approved by Council of Ministers. And so that's why I think working together with Aruba and AZV to learn what's worked well and what hasn't is just logical. And also, they're just a natural partner, especially since their legal systems are similar to ours and makes sense going forward. Last point I have is an update on Zika. The CPS is working diligently on a plan, and actually, again, that's one of the points that Aruba's shared with me, is all of their research and development strategies in terms of how they're combating Zika in Aruba. The numbers here in St. Martin have elevated a bit. This is as of the end of July, the 29th of July. We have now 47 confirmed cases on the Dutch side, and 160 on the French side. And we are working with Curaçao. We've developed a number of videos, instructional videos, and those we hope to be completed soon. CPS is working to get on a prevention plan, of course, including fogging and spraying, and that's something that I expect to have an update from them shortly. But I must admit that you know, the war on Zika really is, as we've said all along, a war on mosquitoes. And our experience so far is that the population isn't as engaged, as knowledgeable, and as proactive as they need to be. So unfortunately, as we're entering the rainy season, now is the time when citizens need to be more vigilant than ever. But we still find way too many examples where citizens are not being proactive about eliminating breeding grounds in our community. And simply government doesn't have the resources to go out and do this for everybody. And so I ask the media to help. I ask citizens to be proactive in terms of understanding what your responsibilities are to the rest of the country, because if you're not eliminating breeding grounds in your own house, in your own neighborhood, in the end, it becomes a problem for everybody in the country. So, thank you very much. Oh, and one more point, sorry. The tripartite committee has been working diligently. This is the health tripartite regarding the construction of the new hospital. As I've mentioned previously, we have received 3 bids, which are in the process of being evaluated by the tripartite committee, which includes representatives from the Ministries of Health, SZV, and SMMC, of course. They are in the process of finalizing their reviews. We've adopted strict confidentiality agreements with everybody who's reviewing that, and I'm happy to hear that there hasn't been any sort of rumors or melee on the street so far. I think the process is going very well, and expect to have some more clarity in terms of the next steps by next week. Thank you very much, sir.
In addressing the situation regarding healthcare and sending patients abroad, I noticed some statements on social media, and I'm wondering if your ministry, along with SZV, the hospital, any of the persons involved when it comes to medical referral, has ever thought about bringing the specialists from the various countries, for example, Colombia and or Santo Domingo, to St. Martin, where they can work maybe on a part-time basis, probably once a month, twice a month, depending on how needed their services are, rather than sending people to spend like 2 weeks and then they have to wait on all kinds of tests and all of that. Have the ministry considered having that done?
Thank you, Bibi. You know, there's a number of issues locally. Number one, the referral time in many cases appears to be much too long. That you know, the time from when a family physician refers somebody to a specialist, I believe, sometimes takes too long. Once a decision has been made that a patient should be referred abroad, that time frame is often, I think, unacceptably long. a high percentage of referrals abroad are for diagnostic purposes, which I think is something that I don't understand personally. I could understand that you may not be able to treat people locally, but I think that at least you should be able to diagnose what you believe the problem is locally. So there's a number of concerns I have about the entire referral process. One of the discussions that we've had with Aruba and as well as with Colombia is that in particular telemedicine, I think, would be a very viable way to help us to reduce those referral times, that we have more clarity on a quicker basis. And I think, Bibi, the idea of exchanging physicians, I mean, it does seem kind of strange that we're fine sending people to Colombia, but when we want Colombian doctors to come here to work together, it seems to be an issue. But that's a licensing, it's a legislative issue, it's something that we're working on but I do think that having physicians from abroad rotate through in order to help on follow-up so that we don't have to send patients back abroad for follow-up would make sense. And I think also working together with our specialists here, it makes all the sense in the world. So it is something that we're looking at how do we improve going forward, bringing in outside expertise to help us. You know, it was very interesting. Actually, a friend of mine has now become the Prime Minister in St. Lucia, and as I was discussing with him about medical care, in St. Lucia they have a hospital that was completed and has actually remained vacant for, I believe, a couple of years. And one of the points that was the reason for it actually is that they've built the hospital to European specifications, and some of the equipment they've brought in is of such a complex and sophisticated nature that they have a problem actually staffing the hospital in order to operate. And so for that reason, it's actually sat unutilized. So as we look at developing a new hospital, and while we're building a new structure and putting new equipment in, we have to look at and be very cognizant of the human resources that are required to staff that hospital. So there's an educational component where we need to be sure that we're training our own people abroad so that they can come back and work from administrators to nurses to doctors. There's going to be all types of jobs available for our people here at the hospital. And I think there's going to be a need for increased expertise, and one way to do that would be to have rotating physicians through. So it's very much part of the development strategy going forward as we look at making healthcare here of a higher quality.
I had a question. Just, I think, about 3 weeks ago, and I'm going to tie this into something else. There was a control done at least 6 stores on Front Street. Stores that are selling so-called cosmetic products that are not the real stuff, very expensive, but a number of illegal employees were found there. Are you at all concerned that the control team is not complete? Because since the incident at Maho, immigration is not at all participating in this team of people that are doing controls.
Understand that when the control teams go out, the only thing that was addressed was that sort of Uber control team where you had all of the multidisciplines in it. There's no reason that the labor inspectors couldn't go out with immigration officials. So I don't know in particular how those inspections were set up, but there is nothing that prohibits the labor inspectors and the immigration officers to work together. And for that matter, as you know, we've been working together with SZV to have them work together. We are in the process of finalizing our compliance guide, and that's something where that's across all of the ministries. We're working on a quick reference guide to compliance. In other words, from an employers and employees perspective, what you're expected to do to be compliant from a tax perspective, but from a work permitting and immigration perspective as well. So I'm not familiar with those inspections in particular, but I do know that it was response to a couple of media articles, And fact is, we certainly could use more labor inspectors, but that's a budget issue.
All right, I think this government, and you in particular, been in office about 9 months. Where are we with the short-term contract? And what's your thoughts on having, instead of a minimum wage, a living wage for St. Martin? Where are we exactly with the short-term contract, the legislation to amend the civil code?
I'm a minister that when I talk about subjects, I like to speak about projects that are basically complete. But to give you an update, the labor tripartite, we've been meeting probably about twice every month, working on the changes to the civil code to address the abuse of the short-term labor contracts. I think that process has gone extremely well. The communications between government, labor, and business, in my opinion, has never been better. I mean, I've seen the tripartite from the other side where, I was a member of the tripartite when I was with the SHTA. So, I mean, I've seen the tripartite function or not function over many years. And I think the level of communication, the trust is, in my opinion, at an all-time high. We've been through the civil codes and come to, in principle, consensus between all three members of the tripartite. So there's a philosophical agreement in terms of what the changes to the civil code should look like, as well as discussions about labor reform, which will not be part of the civil code, but is, again, as a sort of in the explanatory notes or as part of the discussions, even consensus towards a fairly radical reform of our labor system. The changes are now with legal to make sure that there's nothing conflicting. So the ideas were there, but the people, while there was some legal guidance in the process, the actual wording is actually being worked out between legal representatives now, between all of the tripartite, to make sure that there's a final document that everybody's in agreement with. So I hope to have that finalized within the next week or two and ready to go for discussions to Parliament.
Thank you.
Thank you very much for your questions, Bibi. I'd like to acknowledge the presence of our Prime Minister, the Honorable William Marlin. He's also open for any questions that the media might have. Moving along, Leader Singh, Daily Herald. Good morning, you have the floor. Nothing? Okay. Edward Hart, Today newspaper, you have the floor.
Yes, I have a question for Minister Lee. The dump is on fire again this morning.
Yes.
Have there been any thoughts about how that dump will affect the health of the 600 civil servants that will soon move into the new government administration building?
The impacts of fires at the dump on the health of the population has been a priority for the ministry. Of course, citizens that are in closer proximity are more at risk, but I think that the impacts are for everyone in the community. Obviously, as Minister of Health, my involvement in terms of sort of managing the dump is limited. I have brought up the discussions about how I believe the terms of reference or the sort of scope of work at the dump needs to be reviewed, and I know that the Minister of Romy has asked SOAB to come in to do that. As a matter of fact, just 2 weeks ago, there was a company that came in with a product, a firefighting product that will help to extinguish the fires at the dump much faster. So obviously that, once the fires do begin, being able to extinguish them quickly is in the best interest of the community. So that's a product that they say they use for forest fires, they use all over the world, and that's the information's been forwarded to the Prime Minister since he's over the fire department, and will be up to them to decide if it's a viable product for St. Martin, but absolutely has the concerns of the Minister from a health perspective.
Okay. Thank you.
The Gaming Control Board, last that I know of, the Minister of Finance had been, putting the final touches to it. It is probably a rather strange thing, because in 2009, 2010, when we were busy with the transition to Country St. Martin, my office, we had prepared, I was commissioner then, and the departments had prepared the articles of association for the Gaming Control Board, and we had reached to a stage basically where you would say it was a matter of manning it, appointing people. Here we are 6 years later, and in actuality, still no Gaming Control Board. I guess over the years, discussions have shifted as to probably certain areas had to be strengthened, more had to be added or not, but I can have an update for you, let's say in the press briefing next week. It is not something I came, with preparation to discuss, and I hate situations like these where you say something and then next week you would have to say, oops, that was not the case. It's right downstairs, coming upstairs. So, but there is no precise information that I can provide now and say, well, it's a work near completion or within the next 2 weeks, you can expect the announcement of the Gaming Control Board.
Okay, thank you.
Hilbert, thank you very much. Andrew Dick, Daily Herald, you have the floor.
Yes, good morning, ministers. Prime Minister Marlin, the TELEM, any update on the CEO position? I know the last thing was the screening was taking place. The screening still taking place?
We have the Corporate Governance Council that prior to the appointment of an individual, that the credentials of the individual should be submitted. So a candidate, prior to appointing the candidate, the information has to be sent to the Corporate Governance Council. The information had been sent. And then to my surprise, I got a letter a couple of weeks after when you hoped that the screening was being conducted, only to be told that all the documentations were not sent. And one of the things that I wanted, and I didn't want to start an argument because I don't agree, is that the board had nominated 2 persons to the shareholder. The shareholder selected one of those 2 and submitted that name to the Corporate Governance Council. The Corporate Governance Council is now asking for both names with both resumes, and I'm saying, no, that is not your job. Okay? Now, they might be hearing it publicly for the first time. I had, in order to expedite the thing, have the department, my cabinet, forward the information to them. But the selection of the candidate is the responsibility of the shareholder. And if the shareholder says it is Peter, Paul, or Mary, you have to vet Peter, Paul, or Mary based on what the criteria are, what the requirements are, what the capabilities of this person is, the person's resume, etc. And actually, to look if, let's say, a proper procedure was followed. Was there an application? Was there a vetting? Was there a screening? But for them now to go and compare whether there were 2, 3, or 4 candidates to make a recommendation to government as to who government think the candidate should be, that is not their job, that is not their responsibility. So there is some delay there again, but we hope that we will soon get over that hump. In the meantime, also, 3 additional 3 names have been submitted for board members because there are several vacancies on the board of TELEM, and those positions are being filled at the same time as well.
Thank you. Minister Lee, on the exotic dancers temporary policy, were you able to sit down with the owners, or are the permits being processed already?
Some of the permits that were received in the past, as per court order, we took them in, and decisions have been rendered on those permits. As a matter of fact, we just met yesterday with the legal advisor from the club owners, as well as, I think 8 or 9 of the clubs yesterday. They have some concerns, some discussion points about their industry and what some of the impacts might be. And I think there's a number of points we've agreed that we will take a look at it. Some of those are really actually business issues that are related to any business. For example, if you bring in a person and you apply for a work permit for them, you pay the work permit fee for them, and if that person decides to leave after a week, that expense is an expense that the business has to bear. And so is there a possibility, for example, of a credit being offered? And those are things that we said we'd take a look at, but it's actually something that would be a policy for all businesses. It's an issue that all businesses actually have. It's just, I think, the nature of their business. They may have a higher turnover, and they may have more people that have a tendency to leave. So those are questions that we said we would take a look at. And there's a couple other issues, and actually their legal advisor was supposed to meet with representatives from government to try and work out a couple other points for discussion, and then we'll come back to it. But we have met. I think, again, the conversation's open, it's constructive, and we'll see what's possible within the scope of the law.